So pick me up from this tailspin. I'm beginning to wonder if we choose to be.
Okay, so this is Dr. Thornley. I'm a neurologist and epileptologist, and I also deal with chronic pain, and today is part 7 of my series, and today I'll be talking about the effect of cannabidiol and THC on post-traumatic stress disorder, anxiety, depression. So parts 1 through 4, just a recap, goes over indications, how to take it, legalities, the application process in Florida. Now I'm delving a little bit more deeply into the different disease processes and how it works. So with post-traumatic stress disorder, there are usually patients will complain of flashbacks, nightmares, and with cannabidiol, in one study it was found that instead of the learned response to a certain situation, so for example, let's say you have a war veteran who watches a television series regarding a war. Instead of the learned response of feeling anxious or fearful, that response is different, so it's changed. So it works at that level within the brain, within your memory center. And for anxiety, it also helps with, it interacts with the 5-HT1 receptor, which is the receptor that where antidepressants and anxiolytics normally work. Also, so it's very effective with post-traumatic stress disorder, anxiety, and depression. Also, in connection with this, from my standpoint, I think it also works as a very good agent for military veterans because they complain of chronic pain from injuries, they have post-traumatic stress disorder, anxiety, and traumatic brain injury. It's also found to help with cognition in the sense that it was found that in one study that it helps with the executive functioning of the brain. It was also found to help with attention, memory, as well as increases the quality of life. So it has all these beneficial aspects regarding the cognitive portion, neuropsychiatric portion. So PTSD, anxiety, depression. So it's found to help alleviate with any anxious symptoms that you normally would appropriate towards a certain situation. So not only for pain as it's found with, or as it's more commonly found, it's also found to be helpful with conditions that affect your mood, behavior, and your response to fearful situations. Okay, so this is the end of part 7 in my medical marijuana series. This is Dr. Thornley signing off.